Oh,
Hello everyone, I am Dr. Fahim. I am a practicing general practitioner in the United Arab Emirates, and also I am the admin of this group, Dr. Fahim PLAB 2 group. And to be very honest, my objective and aim is to guide everyone so that they are successful in their PLAB examination. So what I decided was just to I'll be making a lot of videos and I'll be posting in the group and the Facebook group as well. And the purpose of this video is to brief everyone of those who are planning to give PLAB, those PLAB 2, those who are beginners in PLAB 2 or those who are about to have an exams. And I believe this particular video would be immensely helpful for everyone. So you see, PLAB 2 is, what GMC, the General Medical Council, expects from an FY2 doctor, that is the junior most doctor in the respective departments. And in majority of the PLAB 2 cases, the scenarios will be based on only on 4 different types of departments. The most common is the GP clinic. It would say that you are the FY2 doctor in the GP clinic, or it would say in the emergency department or acute medical unit. It would be psychiatry. And last but not the least, the teaching stations, which are coming very often these days because they expect you to teach with a junior doctor. So these are the 4 most common scenarios you might be facing, or departments what they would expect you to be working most commonly these days in the United Kingdom. You see, so I will just make some list, some important things which I think would be very good to discuss with you guys. You see, PLAB 2, as I said, is what they expect from the junior doctor. They don't expect you to make a very, a rare diagnosis, or rather a very difficult diagnosis. The scenarios or the cases which they would come up with will be very commonly, very oftenly seen, not even in UK but in other general practice as well, right? Or even in the ER. For instance, making a diagnosis of impetigo. It's a very, very common skin condition. So what these people, what the examiners and the GMC expects, and I would also expect from my doctor, to show the confidence. All right, that confidence is very important. That's where we are lacking. Majority of us are very good doctors, the best clinicians in their particular town, and but what happens is that when we step in and when we see someone not from us, you can say Caucasians, so we have this tendency to kind of panic because we are not accustomed to interact with them, or rather it's not part of the norm to interact with them, and that's where it gets slightly challenging, especially those people whose English is not a native language or English is not commonly spoken. For instance, from Pakistan, as I'm from Pakistan. So you see, the examiner and the GMC, they expect the doctor to be very confident, and whatever he speaks, and he also understands, and he gives a reply very nicely, very thoroughly, with all the genuine sympathy. It should not be a fake sympathy. For instance, I mean, many of the doctors I come across, then they will end up saying, because of the script which is running in their head, that I can't even imagine what you're going through. Imagine 79 other doctors are repeating the same thing, and you would not be getting your scores, guys. And with this, your English vocabulary matters a lot. I mean, you could rather say, I sincerely apologize that this mistake has happened on my behalf. It shouldn't have happened from the first thing. So you see, these are very important things they expect, because if you use a variety, you will be the odd one out, and the chances of you passing that particular station is very high. And sometimes the examiner, and if they are human beings, they will kind of get bored that everyone is repeating the same thing, and they'll be like, okay, fine, it's just, I mean, you would not end up getting scored, all right? But that's how I believe, not a good idea to get your scores. Rather have a variety. Rather have show your skills, demonstrate your English skills. That this is what I am. And then so this was like the general thing. The confidence and your English vocabulary, the way you introduce yourself as a doctor. Now, the most important part, in PLAB 2, because you have 8 minutes for every station, and once you enter the station, by the time you're done with the introduction to the examiner and you sat down in front of the patient, 15 seconds are gone. So that means you have 7 minutes and 45 seconds. So that even delete those, or rather cut off that remaining 15 seconds, you're left with 7 minutes and 30 seconds. In that 7 minutes and 30 seconds, you gotta take focused history, guys. That is very important. I'll give you a classic example. If a patient, like it was in my case of impetigo, do you really think smoking and alcohol is important and drugs is important, recreational drugs? I don't think so, and I did not even ask that because I thought that was not necessary, because the question said address the patient's concern, and the patient concern would be what? When you'll be asking him relevant questions, and then you'll be asking him, like what are the problems, how it's affecting your daily life, or has it affected your work, or your personal life, all those things, and that you have to answer. That's what they expect you to, because you got to understand, every patient of yours has a concern. For example, in Petigo case, she was very concerned that I might give it to my son who's just 6 months. That's a very valid concern, and that is yes, she can give it to her son. And what are the do's and don'ts you got to explain to the patient, that how it can be, it can be prevented. The spread of that particular infection. So focus history. And I would like to end this video by giving you the layout, what is minimum requirement for you to pass the station, rather, and the chances, if you do very good, you can get very high scores. It starts with your introduction. Once you enter, show your confidence, be very good, dress up very nicely, cleanly, be sharp. It applies to both guys and girls. And then you start with, how can I help you? Introduce yourself, which department you are in. If possible, you can say, I'm just from this particular department. And then once you're done with introduction, ask about what exactly happened. Come up with a differential diagnosis. All right, and that could be from Socrates if it is pain, or Odipara if it's something other than pain. And then go to your P3 maphtosa or P7 maphtosa. P3 is for males and P7 is for females. I will give you in depth about what P3, P7 is, all right? But most of us, we already know what this mnemonic stands for. Once you are done with that, please guys, during the history, either right after his or her chief complaint, or during the history taking part, do ask how it has affected daily routine, how it has affected the work, or the work at home, if she's a housewife or he is a house husband. And then go to your eyes. Is extremely important, guys. Do not expect for you guys to pass eyes, that is your ideas, your concerns, your expectation. You cannot pass the station, all right? The same thing expect you to do in MRCP PACES and your MRC GP exams as well. Then you move on to your vitals during your examinations, and then you discuss the diagnosis, of course, after running the investigations, and then it comes with the discussion. So what is the possible diagnosis, and explain about the diagnosis. What are the investigations? Why do we do that? If time permits, and use your basic English, but use good vocabulary. Talk about safety netting, and always end with leaflet. Guys, everyone in the United Kingdom, they love leaflets. Offer leaflets. I'm going to give you leaflets on impetigo, which has a lot of information, and what are the do's and don'ts, and how to prevent, and this and that. All right, it's a very easy way. If you have missed, or you're running short of time, that you think I won't be able to explain everything, what are the do's and don'ts and how it spreads, but you have done your safety netting, you have offered educational purpose, and what else is left? Yeah, safety netting, and always end the station like, if you think you're not getting better, or you're getting worse, or getting fever, just come back to us right away, or go to the nearest emergency department. The patient will be very happy that this doctor really is, taking me as his or her own relative, or blood relative. That's what GMC want, guys. They don't want like a good lot of knowledge. This is just a junior doctor, what they expect from junior doctor. And finally, about teaching station, guys. In teaching stations, please, you cannot teach someone everything in 8 minutes. I was not able to learn examination, respiratory examination or cardiovascular examination or scrotal examinations in just a matter of 8 minutes. Not possible. You gotta be interactive with the doctor or with the student, but not be so indulged with interaction that you miss the main aim, that is to teach the examination. But you take it very slowly. Always pause and ask any questions, any doubts. Just do not hesitate. As if you are teaching your own brother, your own sister, your own colleague, your own best friend. Like, dude, if you forget anything or if you don't understand, just do not hesitate to stop me. Thank you guys. I'll be posting more videos.